And let's bring you some international vaccine news. Denmark, Norway and Iceland have temporarily suspended the use of AstraZeneca's COVID vaccine over concerns about patients developing post-jab blood clots. Denmark was first to announce its suspension of all its AstraZeneca supply, followed by Iceland and Norway. Earlier, Austria as well has suspended its AstraZeneca vaccine. Now, EU medicines regulator, however, has said that AstraZeneca COVID vaccine use can continue pending the blood clot probe. Remember, the AstraZeneca Oxford vaccine is what we use here in India, called Covishield. Well, to talk about all these various issues, the rise in cases and the concerns about the vaccine, we're now joined by Dr. Anub Kumar, Safdarjung Hospital in Delhi, and Dr. Abdullah Samad Ansai, Nanavati Hospital in Mumbai. Thank you, doctors, for joining us this morning. First to you, Dr. Anub Kumar, let's talk about the rising cases and many worries about whether this is the beginning of a second wave in India.
Definitely, this is an area of concern for all of us. Numbers are rising, and I think this was expected, because if people do not follow the COVID appropriate behavior, this is bound to come back. And this we are seeing all over the world, whether it's UK, it's Italy, France, other countries of the Europe. We are seeing so many of the cases coming back, and they are imposing lockdowns again and again. So I think this was expected in India also, because some of the areas we are seeing for the last few months, people are really not worrying anything about this COVID. They are not following this COVID appropriate behavior. A lot of crowded we are seeing in the places, and they are not using any masks, no sanitizers. And so I think this was expected, but I think this is the time to again act on war level. And what all we were doing 1 year back, I think we should continue doing that. There is no place of lethargy right now, and we have to act right now.
Right, and this despite the fact that end of 2020 our cases had come down significantly. Even early this year the cases had come down, and we were seeing a crisis breaking out in Europe and in the US. Dr. Abdullah Samad, now there in Maharashtra is the big worry. It's reported over 14,000 cases in 24 hours. Already you have restrictions back in several areas, night curfews. Nagpur is also under a lockdown, and the Chief Minister warning that it could be in for more areas as well.
So, as very rightly discussed, this is definitely a cause of worry. We are noticing once again nearly more than 1,000 cases every day in Mumbai city, and around 13,000 cases, as you discussed, in Maharashtra. We are clocking nearly 1/3 to 1/4 of cases of the country, and this is again after a long 5 months, this is again a surge. We notice in our own ICUs that there is suddenly a surge of the patients. Though somehow I would say that the relatively sicker populations are still under control, but I think we need to emphasize that along with a parallel vaccination drive, we need to continue with strict lockdown, focal night curfews, probably having more stricter containment areas, and keep on the close vigil. We need to keep on the testing very tight, and we need to keep on chasing the virus, which has been done very well in the past, I would say 6 months. At the same time, I think re-emphasis on the fact that essential services should be continued, non-essential services should be restricted to limited hours, and again going back to the basics, the simple steps of social distancing, mask appropriateness at all the times. And what we see most of the time, people wear masks, but they are not keeping the mask at the appropriate places. So I think that is very important, that you need to comply with the complete mask wearing protocols.
Right, and this, of course, bringing back these restrictions, many are worried about what it would mean for the economy in Maharashtra. Of course, those restrictions being brought back in several areas. Dr. Anub Kumar, when we talk about, people not following COVID-appropriate behavior, we're also in the midst of election time in 4 states and union territory, and we're seeing all these visuals of, top leaders of the country addressing these massive rallies. No sort of restrictions there, no sort of, protocols being followed. So it's really mixed messaging. On one hand, all of you doctors are warning us about, following the protocols, being careful right now. On the other hand, our entire, political leadership is out there attending these massive rallies. So what would you say on that?
I will just request to all the sections of society that they should come together, all the leaders in the respective sectors. They have to follow themselves first this behavior, COVID appropriate behavior. They have to teach their all workers working under them this behavior. So it is applicable to all public functions, whether it's a political functions, it's a marriage,
Sure.
or it's going to any other educational activities. So this has to be strictly followed, and I think I can tell you, center is very serious about that. Our government has issued very strict guidelines I think it's the it's the duty of all our political parties and the respective states to implement those guidelines so that we all can be in the safe zone.
Right, I understand. Well, that's as much as you can say. Dr. Abdul, let's talk about the vaccine now and India's vaccination drive. While it's really, it's become a lot faster as what we expected, but not as fast. We need it to be a lot better. We need more daily vaccinations taking place. Also, now concerns about Covishield or AstraZeneca vaccine in Europe.
So I think it's too early to draw any kind of firm conclusion. We have done a lot of vaccination in our own country, and we have robust data to show that it is safe. Effectivity, immunogenicity, these are scientific questions. They should not be discussed, I would suggest, on public platforms just because of a few stray cases. At the same time, they should be very closely watched. I would, want more important pharmacovigilance and looking at the data more deeply rather than making generalizations. So I think we are good with Covishield and Covaxin both. India has a robust, backup of vaccines, and we are spreading it, giving it faster. I think we should continue the good work.
Right. Dr. Anub Kumar, again, your comments on this, because in Europe, millions have been vaccinated, but a few stray cases here and there of this coagulation or whatever is being described, clotting. What is your view on this?
See, the most important thing is we have not established a causal effect between the vaccine and the side effects. And this is the one which our various agencies are closely monitoring all these cases all over the world. In India, already we have crossed more than 2 crores of vaccinations, and we have hardly seen any of these side effects. So I think India is the leader right now who is showing the path to the whole world, and we should closely monitor these kind of side effects. But I don't think till now we have the data to say anything about these kind of side effects. We all have got, and we have never seen these kind of side effects in our area.
That's
so
right.
I think it should be safe. This should be continued, and we shouldn't have any doubt about these vaccines' safety or efficacy.
Absolutely, that's a point many have raised, that these are a few stray cases, whereas millions across the world have been vaccinated with this particular vaccine. Thank you so much, Dr. Anub Kumar and Dr. Abdullah Samad and Sai, for joining us this morning on the show.